for joining us today. Today, Dr. Shahab is going to provide an update on the current case numbers and where things may be going in the next few weeks. Before he does that, I want to say a quick few words about vaccines. Near the start of this pandemic, I remember Premier Moe saying, "This is not a sprint, it's a marathon." That is still true today, and we still have a long way to go in this marathon. But even marathons have a finish line, and now we know where that finish line is. The finish line is when we have delivered a safe, effective vaccine to a significant number of Saskatchewan's residents. That's where life can truly start getting back to normal. Saskatchewan Health and the SHA have already done a lot of work getting ready to deliver this vaccine. They will have a more detailed presentation on that plan sometime next week. For now, I want everybody to know we in Saskatchewan are ready to go. As soon as the federal government is able to start delivering the vaccine to us, we will be ready to deliver that to Saskatchewan people quickly and safely. This is a huge undertaking involving thousands of healthcare workers and other support staff, transportation, storage, and many other logistical issues. But let me assure you, we will be ready. Premier Moe and I have directed all necessary resources be directed to this effort. Based on the advice of public health officials, we will be prioritizing who will receive it first. There will be more detail on this presentation next week, but it's no surprise that we expect healthcare workers and the residents in our long-term care and personal care homes to receive the first vaccines. We do not yet have an exact timeline on when we will be receiving these vaccines. The federal government is now saying the first deliveries will be early in the new year. Saskatchewan's per capita share that we should be receiving in the first quarter of 2021 is about 180,000 doses, enough to vaccinate 90,000 people. This is just based on the deliveries from Pfizer and Moderna, who have applied for their vaccine approvals. In the last few days, two more companies, AstraZeneca and Johnson & Johnson, have also applied to have their vaccines approved. This could result in more vaccines being delivered even quicker. When that occurs, we will be ready to start receiving the shipments, and we will also be ready to go. This is how we get back to normal in Saskatchewan. This is how our health system will get back to normal. This is how our economy will get back to normal. This is how our lives will get back to normal. It is quite literally the shot in the arm that Saskatchewan needs. And be ready to deliver that shot in the arm as soon as the federal government starts getting us that vaccine. Until then, we all have to keep following the public orders and guidelines to protect ourselves and others. Keep physical distancing, wear a mask, wash your hands, limit your close contacts, and stay home if you're not feeling well. And follow the other good practices that we know to reduce the spread of COVID-19. It's how we keep ourselves and those around us safe. Thank you. Dr. Shahab.
Thank you, Minister. So good afternoon, everyone. So I'll go over a few key messages from my side, and then I'll quickly go over some updated epidemiology and modeling that I promised I'll bring back today. So as we know, we've identified 238 additional cases today, and sadly 2 more deaths in the past 24 hours, meaning that we have lost 13 more Saskatchewan residents since Friday. And obviously, a very difficult time for all of us, and our sympathies with the families and friends of these individuals and everyone mourning them now. And also, we need to recognize, all the friends and families who have a loved one in hospital and the healthcare providers looking after them. This virus, we have seen impacts all of us in our workplaces, schools, and at home, including those residing in care homes. I also, I got several messages from family physicians that asked me to remind everyone that if you test positive, do contact your family physician by telephone Your family physicians can support you through COVID symptoms. For most people, they are mild. You can stay home. 811 can advise you. But if you have other comorbidities, please do keep in touch with your family physician as well. They are in the best position to provide medical support. And obviously, you don't always need to see them in person during that time of isolation. They can support you virtually. But obviously, if you need more urgent care, either Healthline or your family physician can advise you how and where to seek that. Another question that is on everyone's mind is, of course, what are the plans for the holidays for Christmas? And, traditionally, that's a time to spend with family and friends and colleagues. At this point, it is hard to say if any of the restrictions can be relaxed. We will have to monitor closely over the next 2 weeks, and obviously, I'll bring back epidemiology and the modeling in 1 to 2 weeks. But whatever the plans for holidays, we have to recognize that it's very different from last year, and it's also very different from Thanksgiving. And Thanksgiving, our case numbers were around 50 a day, and we could gather up to 15. Right now, our case numbers are much, much higher, even if they go down substantially. I think we need to be cautious over the holidays, but we'll be able to say what exactly can happen safely beyond, being within your immediate household at this time. So with that, I'll maybe go over the modeling slides quickly. So as we discussed, that this is not a prediction. This is just models that show what could happen over the next weeks to months. And it is one source of truth that helps decision makers in government and the Saskatchewan Health Authority to plan for the near-term future as well as the longer-term future. And the goal is to use modeling as well as other tools to make the best policy decisions based on public health information, but also keeping children in school as much as possible, and of course not exceeding the health system's capacity to care for both COVID-19 and non-COVID-19 patients. And we have to look at the long term, as well as the short term. So basically, looking at the indicators quickly, I'm not going to spend a lot of time on the epi slides. They're all going to be online, but we can see our case numbers are increasing. If we look at a comparison with other provinces, we are the third highest in terms of active cases per 100,000, and also the third highest in terms of new cases per 100,000. And our trajectory, if you look at the graph on the right, if you compare the graph in Saskatchewan with other provinces, our trajectory is still going up. In some other provinces, towards the east and towards the west, the trajectory is slowing down, but ours is going up, and we can't see, and I'll show a bit more on the modeling slides, but it is still going up. So I think we need to be very careful for the time being. We need to observe all the additional orders and guidelines that are put in place on Friday, November 27th. And I'll show a bit more with the modeling about what kind of impact we're seeing from that, as well as from the earlier public health orders around mask use from November 19th. This just shows that when adjusting for population, transmission is happening throughout the province. COVID transmission is not localized to any one part of the province. If we look at our cumulative hospitalizations, obviously, they've gone up to 329 ever hospitalized, 84 in ICU, and 53 deaths. This number was up to date since yesterday. So unfortunately, 53 deaths. And if we look at our rates in terms of hospitalization and deaths, really it impacts all age groups. But hospitalization we have seen in all age groups, but certainly it picks up 40 and older. And deaths, unfortunately, we have seen in all age groups, 20 and older, but certainly 60 to 79, 2% of all persons who get COVID, unfortunately, there's an outcome is unfortunate, and 18 over, it's 7% of all cases. The outcome is unfortunate. So again, protecting the most vulnerable by age and by comorbidities continues to be important. And even as vaccine becomes available, till such time that we have the majority of our population vaccinated, it's critical that we follow the guidelines, keeping our numbers low overall, but also protecting the most vulnerable based on age as well as underlying risk factors. I will not spend a lot of time on these slides. This is the current hospitalization in ICU, which again shows that we have hospitalizations in each age group, but ICU is more in the older age groups. And again, I'm not going to spend a lot of time on these slides because that just shows the hospitalization rate. I'm just going to spend a bit of time on this slide because what this really shows is that we have seen outbreaks. These are outbreaks of the last 2 months, and we have seen outbreaks in all sectors. We have seen them in long-term care facilities increasingly. Obviously, we were seeing many outbreaks in sports teams, and that currently has been paused. We've seen a few outbreaks in gyms. We've seen a few in restaurants, but that's been more in staff, less transmission within the restaurant setting. But again, workplaces, obviously, all types of workplaces, office environments, manufacturing, food processing plants. We've seen outbreaks in all sectors. And again, the message here is that some sectors that we were seeing quite a rise, like sports, have been paused. The Ministry of Labor Relations Workplace Safety is there to support workplaces. There's guidelines for workplaces that are online. There are sports there to facilitate quick isolation and contact tracing in partnership with public health. So, workplaces are getting very good at quickly improving their COVID protocols and quickly isolating a case, and if there's a close contact, and minimizing that there would be a close contact in a workplace. So I think there's some good actions happening, and there's some sense that over the last week, we have seen less outbreaks in obviously the sectors that are no longer allowed. But we do continue to see small clusters, obviously, in immediate households and in workplaces that currently are open, and that's important. But just a caution for all of us to revisit how we go to work, how we behave at work, and how to keep our case numbers and content numbers small. Our testing numbers continue to rise and remain strong throughout Saskatchewan, and today there's announced drive-through testing in Prince Albert. So that's a backbone of our, COVID offensive strategy. Our contacts are coming down, so this is really good news. Our close contacts per week have come down to 6.6 from 7.8, so this is really good news. Our range of contacts is also coming down from up to 1. It was as high as 200 2 months ago to as high as 150 to as high as 112. And I'm really happy to announce that, even for the high range of contacts, many of them are in situations where, there were 4 or 5 classes that were impacted. So there may not be close contacts, but as a precaution, 4 or 5 classes have gone online. Not a high-risk situation. We've not seen large outbreaks. And then there were a few situations where 2 or 3 teams or curling teams or curling events resulted in a high number of contacts. Again, that's no longer happening at the moment. And then a few workplaces where there were maybe 10, 20 contacts. So we're obviously not seeing the large gatherings, which are no longer permitted. So that's good news, and this is definitely having an impact on our case numbers. But again, we do need to hold the line because we really need to bring our number of contacts even lower. I said, really, if you become a case today, you should not have many people beyond your immediate household who you can say was a close contact, closer than 2 meters, without a mask for more than 15 minutes. And if you look back 3 days because you are infectious for 2 days before you develop symptoms, and you realize you were in close contact, and that's a good opportunity to revisit your protocols and just improve your physical distancing and mask use and other behaviors at work or otherwise when you're shopping or in other settings. Our active case numbers are still high, 21.8 per 100,000. Test positive rate is 7.6. So again, these are really important indicators. We really want to see both of them trend down, and they are continuing to be quite high overall. And we'll have a bit more on the modeling slides on how that's behaving. So the top graph is just a cumulative, so I think that is always going to go up. But if you look at the bottom graph, and you can see that the blue line is where we want to be. We want to be less than certainly the modeling actually is seeing that if we continue without further measures, this takes into account the orders of November 19th. In a week or two, I'll be able to present the impact of the orders on November 27th. but this shows that if we all comply with the orders, we can bring our case numbers down in December to below 400, which is important, but we still need to hold the course, otherwise the case numbers can rise in January. So again, the cautions around the holidays and why we can't really announce any relaxation of the holidays at this point, and even if there was some relaxation, it'll have to be a very cautious relaxation, because whenever you have a bit of a relaxation, you always see the impact of that 2 or 3 weeks down the road. But again, I think where we want to be is the blue area at the bottom, and certainly not the pink area. So if we hadn't taken any measures over November, we could very well have been in the pink area, which would have been very concerning. And then if we look at this graph, this is similar to the one we showed a couple of weeks ago. The green stars are the actual numbers that are showing that our case numbers are trending up in a way that is very concerning. The orange stars towards the top show where we could potentially be without any public health measures. We really need to make sure we don't hit those marks. We really need to make sure we don't hit 300 to 400 cases a day. That would be quite concerning. So far, the news is mixed. Some days we have 300 cases. Sometimes we have 180. There's variation on how many tests are done, but we average around 250 cases a day. We really need to bring that down. And again, all the actions we're taking are good, but we really need to keep doing that very consistently. And all of us need to do that, not 60%, 70%. All of us need to do that very consistently. And then, of course, I won't spend a lot of time on this, but these are the same graphs, but instead of showing cases per day, they're showing hospitalizations per day. So, they predict that if you do everything consistently, our hospitalization, which has a lag of 2 to 3 days, 2 to 3 weeks after case numbers, can still go up for a while, and that will continue to put pressure on hospitalization, and similarly on ICU capacity. So this again is showing that while the green stars are bending a bit down ever so slightly, the modeling is still predicting that they will continue to rise. Those are the orange stars, and we really don't want to go in that territory. We need to avoid going in that territory. And similarly for ICU census, and I think Mr. Scott Livingston and others will be able to speak further on that tomorrow, but certainly the Saskatchewan Health Authority is planning for at least the blue scenario, that if it gets to a higher demand on hospital beds and ICU. But again, just because the planning is happening doesn't mean that it should be allowed to go to that level. We really need to stabilize our daily case numbers, and 2 or 3 weeks down the road, that can have an impact on our hospitalizations and ICU. And this again is showing that there's a slight downward trend, but not certainly to the extent we would like to see. And finally, I'll just close with a couple of slides that this really shows that the green is where we want to, where we are today, and we want to be where the green is at the bottom. We want to bend the curve. We don't want to bend the rules. We want to bend the curve and follow the public health orders and the Reopen Saskatchewan updated guidelines, so that we can stabilize over December, early part of January. The school break is another opportunity for us to slow things down, to stabilize our numbers, so that we can go back to school in January with less pressure, less cases per day. And again, while people are wondering whether we can meet friends and family outside our household, again, we need to balance that with the risk of a rebound in January. So the green is where we want to be. We really don't want to be where the orange is. And the other thing this slide is showing, that till such time that we are able to vaccinate a majority of the population, which really will hopefully start happening April, May. Till such time, every time we do all these specific restrictions, every time you relax, you see a bit of a rebound. So the rebound can be low in the green, but if we don't have any restrictions and then we tighten up too late, we are in the orange area, our case numbers go to an unsustainable level, and then if you put restrictions, they go down, but then as soon as you relax a bit, they go up again, and that's really, the orange area is unsustainable in terms of case numbers, hospitalization, and ICU capacity. So this slide really says that, we really had to take action, significant action on November 27, based on where our case numbers were. We couldn't have, let case numbers go to, for example, 400 per day. And even now we need to watch. I think we would at least need to continue at our current case numbers with our current measures, hope for some respite over school break when things really would slow down a bit. But if our case numbers do unfortunately keep trending upward, I think we may have to look at even further restrictions. We hope we don't go there, but it's up to all of us actually to keep bending the curve down. This really shows us where it compares us with different provinces. So right now, like I said in that initial map, we are trending very much towards a higher surge. There's some slight early signs this week that we are now maybe plateauing, but we can't rest on our laurels on that. We really need to consistently practice all the measures as announced on November 27th, and this week and next week will be critical to see if we really are trending in a downward direction. And this just shows that we really the restrictions, if they become quite significant, they're not forever. They can be relaxed for a bit, but overall, we really can't loosen anything up till at least April, May, till the majority of the population has been vaccinated. Could we go back to where we were in October in terms of the restrictions in place there? That very much depends on, do our cases come down to that below 120, preferably below 60, and so we'll have to see how our case numbers progress. And finally, I think there's guidelines that are quite detailed, and again, I encourage everyone to go back to go and read them. There's some subtle changes for how to go to a restaurant, around retail activity. Certainly, if you look around, I think there seems to be a bit of a calmness in terms of less traffic in retail locations, people going around more systematically. That's great. We just need to keep on that course. Go less frequently. By all means, support local businesses. Shop locally, either through curbside pickup or in person, but go in a systematic way, go safely. For restaurants, order takeout, go less frequently in person if you choose to go to a restaurant. Again, the guidelines are 4 people at a table, preferably from within your household. If you live alone, preferably the same 1 or 2 people, and then greater separation among tables. At this time, we're not seeing any signals of concern from those sectors with the revised guidelines, same with gyms. Same with conditioning and training activities. We've had a few reports where there was a bit of a crowding in change rooms, for example, or parents sitting close together while children were having conditioning exercises. But overall, the conditioning exercise is designed to minimize transmission so that we don't have the transmissions we were seeing with sports teams, over the last 2-3 weeks. So really, it is up to us to really see how low we can bring our case numbers over the next 2 to 3 weeks, and see, how that helps us to have, a peaceful holiday season that still, wherever case numbers are, it will be a very different Christmas from last year. But, we've learned how to remain connected virtually and be safe, even within our households. But we'll have to see what further recommendations we can give in a week or two about Christmas and the holidays. And then, of course, in January, when school starts again, we again need to observe the same cautions over the second part of the of the winter until spring comes, and we have more vaccine that's available. Thank you.
Thank you, Dr. Shahab. Thank you, Minister Merriman. We'll now move to questions. I'll just note that SHA CEO Scott Livingston is also available on the phone. We'll start in the room with questions here. Murray?
Given that we're kind of stuck between Manitoba and Alberta right now, is there any realistic scenario, given their case increase, for us to be able to lower our case without taking action that involves limiting visits between provinces? And if that's the case, don't we have to start putting in restrictions now with the holiday season coming and people planning to go back to Alberta or go to Saskatchewan, et cetera, for visits? I guess what I'm asking is the twofold question of whether we need those restrictions right now is the only alternative to lower our numbers given Alberta, and whether they need to be in place now.
Yeah, so that's absolutely right. We are not an island, and we are part of Western Canada, and the entire Western Canada has seen an upsurge. So again, my recommendation this time actually is that we need to have a very quiet Christmas, and really the ideal is limited to your immediate household. Certainly, interprovincial travel, unless essential, is not recommended, and many families are already making those plans that not to travel interprovincially unless absolutely essential. Can we get together even as one or two households? It's too early to say, but I think we need to be very cautious because if we relax over the holidays while our case numbers are high, we'll pay the price in January. So again, I think we need to be very cautious at this time. Our numbers are much higher than we were in Thanksgiving. Thanksgiving, our numbers are lower. We very cautiously had up to 15 people allowed, but in some cases people went to multiple events, and we saw a bit of a rebound. And right now, a rebound would be much higher. So again, I think at this point, most people should and are making plans of not visiting within other provinces and having a quieter Christmas and holiday season. But even the ability to meet among close family, one or two households, I think at this point it's too early to say, but we do need to observe great caution.
Would you contemplate a isolation order similar to what we've seen in other provinces? I believe it's generally been 14 days if you cross over and whatnot. And if so, how soon would you contemplate such a thing to perhaps discourage that kind of traffic that you are
So right now, no gatherings outside a household of up to 5 are allowed. I think by isolation order you mean more of a lockdown, a circuit.
If we have other provinces have orders that if you go to visit another province, you have to quarantine.
I see.
Afterwards.
Yeah, yeah.
Is that something you would be willing to recommend, or how would you recommend?
Yeah. I think that's been in place in the Atlantic provinces. We haven't really had that in Western Canada, so I don't think we would go there necessarily. I think really because we are integrated, for work reasons and sometimes for essential family reasons. So I don't think we'll go that far. But the recommendation really is at this point to limit interprovincial travel unless absolutely essential.
Another question in the room, Mark?
Since the last modeling update, we've seen over 3,000 cases and over 20 deaths. Did we act soon enough to make sure that there is going to be, these restrictions are having an effect?
So right now, it is important to note that the modeling, which factored in the measures on October 19th, is saying, according to the modeling, maybe a 30-40% decrease in case numbers and ICU admissions and hospitalizations. So again, I think the modeling gives projections, high, low, medium, and obviously those projections are based on what they are seeing from the data. What I can say is that, are we happy with 250 cases a day? I would say no. We would like to see cases below 120. Are we happy that we're not seeing 500 cases a day? Absolutely. But even though we're not seeing 500, that's not where we need to go. So I think we have to look at what we're actually seeing and what the modeling is saying. So there is some impact of the November 19th measures. We are hoping that the November 27th measures are going to have an enhanced impact. I'm already seeing that in terms of obviously no further outbreaks in sports teams, some clusters related to workplaces, but even there, they are small clusters. Number of contacts are coming down. The range of contacts is coming down, but we need to really stay the course.
Follow up, Mark?
How does the province plan to control COVID-19 outbreaks in long-term care facilities? And are there plans to implement frequent testing at those facilities for staff to ensure that they are safe?
Yeah, I'll maybe make some initial comments, and Mr. Livingston is on.
He is, yes.
And then Mr. Livingston could add some or get some further information tomorrow. But again, I think long-term care staff have been working extremely diligently throughout the last 10 months. But unfortunately now with increased community transmission, we are seeing many outbreaks and unfortunately deaths in long-term care facilities. Certainly personal care homes, the government is working very closely with personal care homes in trying to, in enhancing their ability to manage cases and clusters. The Saskatchewan Health Authority is supporting personal care homes as well as long-term care facilities. It is very challenging. It's very challenging in terms of visitor restrictions. It's very challenging for residents who can't see their loved ones. When there's an outbreak, it's challenging for staff and residents. But it is something that we are now facing for the first time. We didn't really see any outbreaks significantly in long-term care, personal care homes till now, the last 4 weeks. But it is something that, as best as we can, is being managed. But it is something that I think is the most high risk out of all the outbreaks that we're seeing in terms of impact on residents and staff and families. I don't know, Mr. Livingston, if you had anything to add?
Yeah, just a little bit, Dr. Shahab, but just to follow up that, to remind folks that one of the reasons we're seeing this spread in long-term care is because of widespread community-based transmission. And we continue to keep protocols in place to limit traffic, as well as the screening of staff, visitors, appropriate use of PPE. And to answer your question with respect to both resources around outbreak management, we're looking at how we immediately build a human resource pool to help support outbreak management in long-term care, because it's something we've seen a lot of recently, as well as with respect to testing. Yes, there is a testing pilot in place right now with 8 long-term care facilities for some of the new testing devices, the Abbott PanBio and Abbott ID Now. And once we get through that pilot, we'll be expanding surveillance into long-term care, because that's what the pilot is in. It's in long-term care, both staff and residents. And we'll be putting that surveillance in place, increasing our testing capacity to actually try and identify cases early to ensure that we keep those residents in long-term care as safe as possible.
Take our next question, Stephanie.
Dr. Shahab, what would the 7-day average of daily cases have to be in order for you to make a recommendation that we could loosen up some of the household gathering restrictions to allow people to get together at Christmas?
So I think I'll give you my preference, but then what does it have to be? Ultimately has to be a decision that is based on my recommendation, but on the benefit of allowing loosening versus the risk down the road. So generally, and I've always said, 5 cases per 100,000 lower is where we are comfortable, and that's less than, on average, 60 cases a day. Anything between 60 and 120, we are in the concern area. And right now we're at 20, 22 cases per 100,000 per day. And then the challenge, of course, is that in the summer sometimes we would go up a bit, but it's a localized outbreak. Right now it's widespread. It's winter. And so all those factors actually make the same case numbers more concerning and harder to manage, because the transmission is happening much more easily. So that is predicted, the fall surge. We saw it a bit later than other jurisdictions, but that's exactly what was predicted. So again, I think we've all adjusted. The weather's been milder. You see many people at least making the most of the mild weather and being outdoors more. But again, I think it is very challenging to get together with friends and family with the current case numbers. And certainly my preference is less than 10 per 100,000. But obviously we have to look at other factors, and it's always a trade-off. If you allow a bit of a relaxation, if everyone complies and most people actually choose not to get together, then you may not see a bit of a rebound. But if most cases get together, there's high transmission, that will just accelerate the transmission. And again, that is what the modeling and the epidemiology unfortunately signals.
Follow up, Steph?
Yeah, to the minister, for the vaccine, distribution rollout plan that we can expect to see next week, is there going to be a component of a misinformation education campaign? I mean, there's been people outside of the legislature, even, as soon as, far back as yesterday, talking about how they, don't want to get vaccinated and kind of pushing different conspiracy theories. So is that going to be part of this vaccine rollout? And how concerned are you that people in this province could choose to just not get vaccinated?
Well, first of all, I'd encourage anybody to get vaccinated. This is the quickest way to getting us back to a normal life, that we can start doing all of the things that we were doing this time last year, and we were warming up for Christmas. If people choose not to get the vaccine, that's their personal choice. There's going to be nothing forced on them. My role is to make sure that I have the vaccine, and when I get the vaccine, that I get it into people's arms as fast as possible.
Lynn?
Since November 16th, we've had, I think, 120 healthcare workers test positive,
Yes.
and I'm assuming that means a lot more self-isolating. This might be for either one of you or Livingstone on the phone, but what kind of strain is that putting on the healthcare system, and where are we getting other healthcare workers from to fill all those spots?
I can maybe start, and then maybe Scott can join in. It is putting some pressure. We're seeing pressure from externally into our healthcare system from the general public. Cases that Dr. Shahab just outlined, certain demographics and ages of people that are coming into our healthcare system. But we're also seeing people within our healthcare system get ill. And again, it's no fault of their own. This is communal transmission that we've seen on a lot of cases. But when we have several nurses or several doctors go down, it causes a ripple effect with our healthcare system. The SHA has done a great job of designing contingencies that if this particular unit goes down, that there is backfill. That's why we're constantly adjusting what we have to do on a daily basis. If we have a dozen nurses that go down in a town of 20,000, that's fairly significant. We have to start pulling from other areas to be able to do that. We do have that set up, but that also creates a ripple effect of second and third kind of generation of people that we have to be able to backfill as well. So there is a ripple effect on that, but we do have plans for all of that. It's just a matter of how quickly we can execute those plans, and so far we've been doing an extremely good job of that. I don't know if you want to add anything, Scott?
So the only thing I would add is just confirm that it is a significant challenge for the organization as these outbreaks are occurring in our facilities with our staff, and particularly as the minister has outlined, but we do work as hard as we can to backfill as quickly as we can. In some cases, services are slowed down for short periods of time because of it. And the only other thing I would mention is it's not just outbreaks that are occurring in our facilities. There are outbreaks in partner facilities, private personal care homes, and in the case of the correctional facility where we also are involved and help is supporting that. And it's just one of the challenges that we're facing, and one of the reasons why we continue to call on the public to try to reduce contacts as much as possible. It's really that high level of community-based transmission that is bringing the disease into so many different aspects of our community, and it's so important to work hard as a community to try to drive that down.
Follow-up question, Lynn?
The SHA sent a letter to a lot of the physicians saying that they're kind of encouraging them to get training in other areas to backfill in some of those things like emergency and ICU that are maybe short sometimes. And it seems like Herbert and Lanigan are losing some services because of staff redeployment. So like, are there specific areas like doctors that we're seeing more of those shortages, and are rural communities at risk of losing their staff to backfill that?
Well, I think it's just the impact is immediate within rural Saskatchewan. If you only have one or two doctors in a specific area and they go down, I mean, that's a huge impact, whereas in the city we have the opportunity to move people around. Within rural Saskatchewan, we've been able to adjust, and we do have to start flowing services towards the larger centers, just because there's the opportunity to backfill there. But there are where we have moved from one city to another. We've looked at people going from Herbert to potentially backfilling in Swift Current and Moose Jaw. Depends where the need is where we're going to allocate the people.
Do we have a question on the phone?
We have Lisa Schick with CJME.
Hi. I'm wondering, this is a question for either the minister or maybe Mr. Livingstone. My question is on contact tracing. We're hearing a lot of things that contact tracing is behind. There's a lot of work to do and not enough people to do it, that kind of thing. So why is this a problem, and what's being done to fix it?
I can start on that. The biggest impact that's going to have on the contact tracing, which Dr. Shahab just outlined, that our contacts are going down, is our bubbles that we're in. The less people that we have contact, the easier it is for people to contact tracing. We've seen surges in our numbers in our major center, obviously in Saskatoon and Regina, and we're trying to work as fast as we can to make sure that any positive cases that have been identified are notified within 48 hours. That's our goal. And we'll continue to strive to do that, but depends on the day. We could have a fluctuation, as everybody is very aware of, anywhere from 180 up to 350 up to 400 people that we have to contact trace in a day, and that changes things dramatically. And then on the negative contact tracing, if somebody's going back and there's a negative test, and we have to be able to, we'll do that a little bit later on, but it's more important to touch base with the people that are positive so they can react as quick as they can.
Follow up, Lisa?
Yes, my other question is on school cases. We are seeing a growing number of cases in schools. It seems like every day there's multiple reports of cases in schools. I know they're kind of dealing with that fairly well, but we've heard that there needs to be a signal from the provincial government for school divisions to make the decision to go to full online learning. So I guess, what are the concerns about cases in schools, and at what point would the province make that decision to say if the divisions want to go to online learning, then they can?
Yeah, so I'm in regular contact with the Ministry of Education and the school divisions, and school divisions are regular contact with local medical health officers. So at the moment, you're right, the schools have done extremely well. Their case numbers are a reflection of high community transmission. So we have had 212 schools with a total of 347 cases so far. And of those, 154 have been elementary, 63 high school, and 39 other. 138 have resolved with just a single case. In 30 cases, there were 2 or more cases, which was an outbreak, and in 85, it's still under investigation. So overall, most schools are still coming out with just a single case, and in many cases, the acquisition is not in the school, it's in the community. Some schools, some large high schools are already in level 3, alternate day attendance. Some schools have gone to online education or remote education only, and that's more for operational reasons, because if you have many classes already online, it may be easier operationally for the whole school to go online. At this point, locally, school divisions may have to elect to go online on a school-by-school basis as dictated by operational reasons in consultation with the local medical health officer. In terms of the government's role, I think the government, including Ministry of Health and Ministry of Education, I think is fully supporting school divisions to make whatever adjustments they need to. But at this point, again, I'd like to reiterate that schools have done extremely well, and this really speaks to parents, children, teachers, staff, all complying. We've had a few situations where there's been transmission in a school bus or a classroom, and especially in a school bus where mask use, for example, was not consistent. So again, we're getting really important information about all the layers being important, especially when community transmission is high, including consistent mask use, for example, in common areas like school buses. And so that's, again, a reminder that, we all need to practice this behavior and model that in our homes in terms of most children now are very knowledgeable about mask use and how to take care of a mask and hand hygiene and physical distancing. But again, these are things that we need to continue work with our children in the home. And of course, teachers continue to support children to be safe in the school setting.
We'll take another question on the phone.
We have Laura Sharp-Patelli with CBC.
Hi there. Thanks so much for your time. This is for Minister Merriman. I'm just wondering, I know that there's going to be an update next week on the vaccines, but I'm just wondering if you are looking to any other countries or provinces to kind of have some ideas of how to carry out the distribution. Where are you getting your kind of plans from?
We actually have a very robust plan that Dr. Shahab was involved with back with our H1N1 when we did that vaccine across our province. We also have one of the highest immunization rates in our country. So I'm feeling very comfortable with how we're going to distribute when the vaccine arrives. We're working with the federal government. I just talked to the federal minister yesterday to be able to discuss the timing of that, and they're working diligently with at the political level, but also at the ministry level to be able to make sure that we get those vaccines and we get them distributed across the country as fast as possible.
Follow-up question, Laura?
No, I don't. Thank you so much.
We'll take our next question in the room. Adam?
I know you said April or May, Dr. Shahab, for majority of the population, I think you said. Can you just give people a sense of what the timeline is in your mind of when we could see most people vaccinated? I know there'll be more announcements, but earliest we could see, and then maybe possibly the latest, what they can expect from what your best information is right now.
Yeah, so like the minister said, this is a very dynamic environment internationally, nationally, and for us at a provincial level. So at this point, I think we are very happy that there is going to be initial rollout of at least 2 vaccines, pending licensure and approval. That's Pfizer and Moderna product. But then, very quickly there may be additional vaccine candidates that are approved and are become available. We hope certainly by like the current vaccines that are in line, plus possibly additional vaccines. Certainly we expect to see an increase in supply towards the end of the first quarter and beginning of the second quarter, like around March, April. And like the minister said, we are fully, we vaccinate over 4 to 6 weeks more than, a third of the population with influenza every year. This year, we are ready to vaccinate half the population. That's a yearly program. So, we are fully equipped to be able to manage as many vaccines as we get. And I think in the H1N1, if you remember, we had a very systematic, sequenced approach. And so we are confident that as soon as more vaccines become available, especially towards the end of the first quarter and beginning of the second quarter, we'll be able to offer as many vaccines as we receive in real time. And that will really be important. High vaccine uptake by the population in spring and early part of the summer will be key for us to come out of this pandemic.
You mentioned a rebound potential in January if there were high cases, people went back to school, for example. If there are higher cases or in the same position we're in right now, would you consider recommending a longer Christmas break for schools to not send kids or teachers back into classrooms, or is that something that would be considered or no?
Yeah, so, again, this has been an active area of discussion with our colleagues and partners in the Ministry of Education and the school divisions. Right now, obviously, teachers and schools feel very, and they're right, that they feel very strongly that the best place for children is school, the benefits of in-class learning in the fall. And so at the moment, the plan is to have a regular school break. For some high schools, they are already in hybrid learning. A few schools have gone online for a couple of weeks. So we'll continue to see that if there's any additional benefit of extending the winter break. But at this point, it appears that it'll be a regular 2-week break and regular start of school out in January.
Can I just speak on that? Do you think the fact that schools haven't seen transmission and the kids have been wearing masks, teachers have been wearing masks, we're doing all the physical distancing, hand washing, is that a validation that a mask use and following the public health can be effective because schools have been fairly successful in not having cases and transmission within schools?
Yeah, I think all the layers have been important. So not going to school if you're sick, staying home, seeking testing and then isolation, both case and contacts. Being in a fixed cohort in a classroom. And so again, I think schools have done a lot of efforts, elementary, but especially high schools, in minimizing and having a smaller cohort. And then, of course, mask use. We've already seen evidence that where mask use slips, we do see clusters in, for example, the school bus situation. So I think all these layers have been extremely important. And again, the more I look at it, I think the school numbers have been well below what my expectation was. So again, it speaks to the innovation and resiliency of teachers and staff and parents and students.
We'll take our last question on the phone.
We have Brian Zinchuk with Glacier Media.
Dr. Shahab, using the 7-day averages, North Dakota peaked on November 14th, 18 days ago, and has since cut their cases by half, from over 1,389 down to 673. Manitoba, at the same time, plateaued around the 11th of November, and for 22 days has been essentially flat. In the same period, Saskatchewan has essentially more than doubled its numbers, and we're now at 274 per day average. So why are we still growing when the others are not?
Yeah, thanks for that. And so on a positive note, our epidemiology and modeling is showing that the additional measures announced on 19 November are having an impact. And instead of seeing 400, 500 cases a day, we are seeing around that 250 on average a day. So that's on a positive note. But we also know that, and we'll be looking at the impact of the further measures announced on November 27th, We have some early indications of some impact on that and slowing transmission, but we'll know more by next week. Because it takes up to a week or 2 weeks for any additional measures to have an impact. So, this week and early next week is going to be critical, because that will tell us, are the measures on November 27th enough, and what do they, forecast for the holidays. Because there is a 1 to 2 week lag for case counts, and then a 3 to 4 week lag for ICU and hospital sessions. But even if we plateau at 250 cases a day, that's still very high. That's still 250 cases a day for a sustained period of time still puts too much pressure on the hospital and acute care and ICU system. So we do want that to start trending down. But I think even if we all practice everything consistently, which we all should now, it'll take us a week or two to see that downward trend. But absolutely, we would like to see this plateau and trend down before we hit even 300, and certainly not go as high as some other jurisdictions have seen.
Follow-up question, Brian?
Yeah, the modeling that you released 2 weeks ago had a forecast model, and again, this is a model, but said by November 29th, you were looking at a range of between 660 and 2,100 new cases per day, with the midpoint being over 1,300 cases per day. And in reality, we have trended much, much lower than that. Like you said, around 250, and we're well below the blue band we saw on that hockey stick curve. So can you speak to how effectively that has made a difference?
Yeah, so obviously the modeling projects everything, including scenarios that would be unacceptable. So I think the whole purpose of the fact that we are in our 10th month of the pandemic and working so hard, every Saskatchewan resident, every business, the healthcare system, the reason we've been working so hard is that none of us wants to see the worst case or even the pessimistic or the mid-range scenario. We don't want to go there, because some jurisdictions in the world have seen that, and that has been totally devastating. So we really want to stay in the blue or green area, and that's why we can argue that should we push harder earlier, or should we wait a bit? But the fact that we have been taking action over the last 2 weeks with more specific restrictions that obviously put some hardship, that we can't play in sports teams. We have to go in a more systematic way for retail. We have to be more thoughtful if we visit a restaurant. Obviously, there's some hardships, but they are, I think, very acceptable compared to the impact if we didn't have these. So again, I think at the moment things are starting to trend in the right way, but we need to be very consistent, and we all need to practice this, because again, if just a few people don't practice this, that adds to hundreds of cases a day. And so I think, again, that's the message, that we all need to be very consistent and diligent with doing all the measures that are in place right now.
And with that, thanks everyone. That concludes today's update.